Welcome to a new episode of Science in Context. I'm Sabine, and this week, Dr. Rob Johnson speaks to me about a recent publication on healthy populations as a pandemic preparedness strategy in Mexico. Rob, what motivated this work?
We were working with partners in Mexico's National Institute of Public Health, who participated in Mexico's COVID-19 response. Early on, high BMI emerged as a predictor of worse outcomes with COVID-19. BMI is the body mass index, a measure of your weight and height, and a BMI of 30 or more can be used to diagnose obesity. A high BMI is also associated with a higher probability to be infected, which means that a person is then more likely to go on to infect someone else. Mexico has a high rate of obesity, so we were interested to know, how would the epidemic have looked if the population had had lower BMI overall?
How did you model reductions in BMI, and what impact did it have on the COVID-19 epidemic in Mexico?
We considered two interventions that aimed to reduce population BMI. We asked, what would have happened if warning labels on products high in calories, sugar, sodium, or fats would have been introduced before the pandemic? And also, what would have happened if taxes levied on certain high-calorie foods and on sugar-sweetened beverages had been increased? We used results from other studies to model how these interventions would have impacted consumption, BMI, and ultimately the COVID-19 epidemic in Mexico. We found that these interventions could have averted tens of thousands of deaths.
Given these results, what does that mean for future policy strategies and pandemic preparedness?
Well, we often think of pandemic preparedness as being investments into vaccine production or hospital capacity. But one of the strongest determinants of how bad an epidemic will be is how healthy the population is in the first place. That is, investing in a healthy population is key to being prepared for future pandemics. And pandemic preparedness is providing another motivation to identify effective ways to disrupt the obesogenic environment.
Thank you so much for your time today.
Thank you.